Let's talk about only available private room. Right. So this question is on the NCLEX exam. Something that you need to know for the NCLEX exam. Now, NCLEX can test this in two ways. One, infection control. Two, mental health. Right. So NCLEX can test it this way. Now, how do you know if your question is only available private room? Now, look at how you can know on the NCLEX exam. Now, if you look at the stem of your question, you are going to see this keyword right here. Only available private room. Let's look at another question. Right. Private room. This is the stem, right, of the question. Right. Let's look at another one. Look at this one too. Only available private room. And this is the stem of your question. So that's how you are going to know if it is what only available private room question. Now, since we now know how to know if it's only available private room, how do we now know if it's testing you on infection control or mental health? Now, if it's infection control, the NCLEX is either going to make sure that all the answers are related to infection or symptom that are related to what infection, right? Or maybe one symptom I mean is related to what infection. Now, if it's a mental health question, then all the answer key will be related to what mental condition. Now, this video, right, we are focusing on what infection control related, yeah, available private room related to infection control. That's what we are focusing on in this video. So we are not doing this, right? So but now look at the answer keys. Now you can look at these answer keys. All of them are all related to what infection. Now take a look at this. These are related to what symptoms, right? They are related to symptoms, right? If it's mental health condition, your every symptom right here will be related. They are going to be related to a mental condition. You can see there's nothing right here that's related to mental condition right here. Now, and I've told you earlier on in the video, NCLEX only tests available private room related to two things: infection control and mental health. Right. So obviously, since this is not mental health condition or symptom, we definitely know it's infection control. NCLEX is trying to test us right there. And this last example, you can look at it, everything are all related to what? Infection. So now we now know how to identify infection control available room question or private room question on the NCLEX exam. So now what we need to now know is how do we now answer this kind of question. Now, one is that we use what we call um we use this arrangement. We use the principle because only available private room, we are trying to put the patient into that room because they have infection. That's one. They must have infection. But you know, your answers have what? Your answers have four infection for you. One, two, three, four. Right. But we are trying to put the what most contagious patient in what? The private room. So all of them have infection, yes. All of them have the ability to infect another person, but we are trying to put the most contagious patient in the room. So how do we know the most contagious patient in the room? Sorry, to put in the room, right? You all start from airborne because this is the first most contagious infection you can have, followed by immunocompromised patient. Right, this is not an infection, but we put them uh second on the list to get the private room. Why? Because they are at risk for infection themselves. Right. Third, droplet, and fourth, contact. So this is the arrangement. Now when you are looking at your answer keys, these are you want to look at your answer keys. Now you identify the question is testing you on only available private room or what private room. Then you check through the list and you've seen everything or have what infection. Then what you are doing now is to now look for airborne infection on the list. So you are going to check infection 1, 2, 3, 4. If anyone is related to airborne, then select the answer that is correct. But if you did not see airborne, then you are going to start looking for immunocompromised. Right, you check the list again. If you did not see immunocompromised, then you move on to the third one. Now, let me tell you, a lot of students know airborne infection, they know droplet infection, they know contact, but immunocompromised most time they don't know. So let me give you the list. We have HIV, we have patients on chemotherapy, we have transplant patients, right? And then we have neutropenic, right? Neutropenic patients. So this is the list right here. So if you see this on the NCLEX exam, you know they are what? Immunocompromised patients. Now, if we did not see immunocompromised patient, we start looking for droplets. We look at the list again. If we did not see droplet, then obviously the last answer will definitely be contact. Now, one thing I want you to know is that despite the fact that you have airborne immunocompromised droplet contact, NCLEX always like to pair all this infection together with infection that only require what? Standard precaution. Right. NCLEX like to pair it with infection that require standard precaution. Standard precaution infection is not as dangerous as airborne immunocompromised droplet contact. So don't make mistake in selecting infection related to standard precaution over this infection. Follow this list: first, second, third, fourth, please, so that you don't get the answer wrong on the NCLEX exam. Be able to identify what a standard precaution infection, so that you don't think, oh, that is contact. No, contact infection is different from standard precaution infection. Right, that's what you definitely need to know, please. Right, let's not make that mistake on the NCLEX exam, because a lot of students, the first problem they have is, now you this is a clear principle of how to answer the question, but they don't even know what infection fall under airborne. They don't know what condition fall under immunocompromised. They don't know what condition fall under droplet and also contact. So that is the problem. So before you start applying this principle, the first thing you need to do is to know what infection is under airborne, immunocompromised, droplet, and contact. That is the first initial thing you need to start doing today. Now, so with that being said, the next thing or next way we tend to answer, or the way your question can also present on the NCLEX exam, is through symptoms, right? So we want to identify the symptoms, right? We have what? um we have airborne droplet contact, right? Contact is through skin, right? Skin, hand, right? You use your hand to touch the skin, you get it. Sometimes it might be stool, right? For example, hepatitis A, right? Hepatitis A is the only contact infection. B and C, B and C is standard. So don't make that mistake on the NCLEX exam. Right. B and C is standard. What you need to know for the NCLEX exam is A, B, C. But A is contact. Right. Droplets, airborne and droplets, they are both respiratory. So you can see any symptom related to respiratory. Right. Maybe something like night sweat, sneezing, coughing, right? Or maybe they tell you something related to their oxygen, their respiratory rate. You know the NCLEX is definitely talking about airborne droplet, right? So yes, if NCLEX say night sweat, NCLEX is talking about TB, right? So that's what you want to know. If NCLEX says sneezing, coughing, it can also be TB as well too. But at least since NCLEX is not like making it clear if it's TB or any other kind of infection, we might also be thinking maybe this is droplet or airborne, depend, right? But this is how you analyze the, what are they calling it, the answer keys. Now contact might be maybe tears as well. To maybe NCLEX might just say something like tears, maybe it's a eye problem, and then it tears we are thinking about an eyes infection, right? So yeah, I'm just giving you the clue of how NCLEX, right, give you this kind of infection, right? So yeah, pretty much that. Now, but the most important thing you need to know is that don't make mistake in selecting infection that are related to standard. NCLEX will not test you on standard. NCLEX focus on airborne, immunocompromised, like your answers are going to be related to either airborne, immunocompromised, droplet, and contact, and you need to follow that what arrangement. So yeah, so now let's answer the questions we have right here now. So I don't need to read the question. We already know this is only available room question. So now let's use the principle airborne, immunocompromised, droplet, contact. Now hepatitis C is standard, so out. There's one thing I did not explain. Right, if NCLEX use this keyword titer, titer means no infection. That's what titer means. Titer means no infection. So this no infection. Right. So since this is a no infection and this is standard, any answers that is related to standard exit out. We are dealing with only this. So this is standard out. This is no infection out. This is no infection out. So we are left with three. Three is what? Pneumonia, and pneumonia is droplet. Right. So that is that. Now let me now show you another format. It's not another format, but I'm just trying to break it down for you. So we have airborne, immunocompromised, droplet, contact. Now, is this airborne? Do we have any airborne on the list? That's how I want you to like maybe approach it. Now, do we have airborne on the list? This look like airborne, so uh, but the airborne has titer. So because it has titer, it's automatically telling me no infection. So I'm going to exit out. We don't have any other airborne, so airborne is out. Now, immunocompromised, HIV, kidney transplant or any kind of transplant, not necessarily kidney transplant, any transplant, um, chemotherapy, neutropenic patient, there's none, so out. Droplet, yes, I have droplet right here. So since I've seen droplet right here, trust me, that will be my answer. Even if I've not started looking at this yet, droplet that came next, because we don't have airborne, we don't have immunocompromised, we have droplet. Droplet will definitely be my answer because that's the next, and then I move right. But titer, remember, no infection, hepatitis C, that is standard precaution. NCLEX don't deal with standard. So yes, the answer is three. Now let's move on to the next. We also know this is what available private room question. So but these are all symptoms. This is red eyes with moderate tearing. This is related to eye infection, and eye infection is what we call contact, right? Let's put our thing right here again. Droplet contact. Right. So we are looking for airborne. Productive cough. You can see I said either coughing or sneezing. These look like um airborne because we don't really know. Right. If you don't know the infection, okay, this is it. If you don't know the infection, and then NCLEX mention something like coughing, sneezing, you can easily think airborne or droplet. So right here I can put airborne or droplet. Right here I already have contact. Right. But let me say airborne or droplet. Let us say I've not gone through this already. I'm looking for airborne droplet. So that's the first one. So now, since I already know the answer is airborne droplet, I've seen something related to airborne droplet right here. 100% this will be my answer. Let's approach it again. Now, this is the principle, right? This is what we are using. This is what we are using, right? Oh my god. This is what we are using. Now, so first thing I'm looking for airborne, and I'm saying this not airborne. This is related to either airborne or droplet because we are not really saying the name of the infection, but we are saying cough. Airborne droplet is respiratory. So cough and sneezing is related to both airborne and droplet. So I will either believe this is airborne or droplet. Right. So I don't even need to look at this and this. Since I've seen something that is related to airborne or droplet, I'm 100% going to select my answer. The only reason why I'm going to look at the other ones is if there's immunocompromise or if there's another droplet. Right. If I look at this, this is not related to droplet. If I look at this, is not related to droplet. This is not related to immunocompromise, and this is not related to immunocompromise. So I'm still left with this. Right. If I look at this, this is contact. Right. This is contact. This is eye infection. This is contact. So this is still going to be my answer. Even if I don't know if it's airborne or droplet, that's still going to be my answer. But coughing can be related to airborne droplet. Night sweat is related to what? TB. right? So that's airborne, right? If you know the symptom, but even if you don't know the symptom, that will still be the answer. If you don't know the symptom of TB, that's still going to be the answer. Even if you are taking a random guess that you can either be airborne or droplet, you are still going to get the answer correctly. You can see how you can easily answer the question. Now look at this one, right? Let's put our arrangement again: airborne, immunocompromised, droplet, and then contact. So now I'm looking for airborne. Is this airborne? No. This not airborne. This not airborne. This not airborne. So airborne out. Immunocompromised. Is this immunocompromised? No. Is this immunocompromised? No. No and no. Right. So immunocompromised gone. So let's look for droplet. Is this droplet? No. Is this droplet? No. Is this droplet? No. Is this droplet? No. Out. So now let's look for contact. This is contact. This is standard, this is standard, and this is standard precaution. This is the only one that is contact precaution. So guess what? My answer is 1. Right, you can see how the NCLEX work. Remember I said earlier on, NCLEX can include all standard precaution answers alongside with your option. Right, now a lot of students we asked also, um how do I know which infection is what standard precaution? It's very easy. When you know what is airborne, you know what is droplet, you know what is contact. So anything that does not belong to airborne, or does not belong to droplet, or does not belong to contact, obviously will be what? Standard. This is standard because it does not belong to contact, it does not belong to droplet, it does not belong to airborne. This as well too is standard because it does not belong to airborne, droplet, contact. Same as this too. Does not belong to airborne, droplet, contact. So definitely I will believe it's standard. But if it's related to this, that's when I can now start thinking about it. But it's not related. All this right here are all what? Standard. Right. So that is how you pretty much approach the question. So your goal, if you are still struggling with this, the likely problem is because you don't know the infection that is airborne, immunocompromised, droplet, contact. So your goal right now is to go and look for infections that are related to contact, droplet, immunocompromised, and airborne. That is your goal, because that is the only way you can answer this question when you now know this arrangement. You know this is first, second, third, fourth. And then you also want to know symptoms. What are the likely symptoms that the NCLEX can give to me that will show the patient is having airborne? What are the likely symptoms the NCLEX will give to me that will show the patient is having droplet? What are the likely symptoms that the NCLEX will give to me that the patient is having contact? What are the likely symptoms the NCLEX will give to me that will show that the patient is having immunocompromised? That is what you want to know. Right, when you know this, trust me, you are good to go. Now in order to recap, remember, how do we approach it? Firstly, we want to identify that the question is testing us on what? Only available room or private room. It can be private room like this. You can see this one right, a private room, or only available private room like this. The moment we can identify, we are now asking ourselves, are we dealing with what? Infection or mental health condition? Right here, we just check if the um answer keys have or infection, or they have symptoms related to what? Maybe infection as well, or the symptoms are not related to mental health condition that we have right here. Once you are able to identify all that, then you know, oh, it's infection control question, and then you apply the principle, checking out the symptom, or using what? Your A, which is your airborne, immunocompromised, droplet, and contact. Right, so yes, this is everything you need to know about only available private room. Right, so once you can follow the principle, I can guarantee you, when you see a question like this on the NCLEX exam, right, you are definitely going to get it correctly. So I'm going to see you in my next video.